7. Study Session 12. Objectives of Rehabilitation. Introduction. The aim of this lecture is to introduce you to objectives of rehabilitation, their symptoms, as well as classification. The lecture will also help you to differentiate between simple deviance and maladaptive behavior deviance from maladaptive behavior. Objectives. At the end of this lecture, you should be able to 1. Explain the objectives of rehabilitation. 2. Discuss the types of rehabilitative assistance you know. Content. Institution or clinic-based. The process involves the client, caregiver, and the professional. The professionals, such as occupational, speech, and physiotherapists working in rehabilitation, are based at the hospital, clinic, or institution, and offers hands-on therapy to clients on a daily basis. Individual and group therapy approaches involve a wide variety of activities. Home visits are only done when necessary. A multi-professional team approach is optional. Community-based. The process involves the community, the client, the caregiver, and the professional. Community members and clients with disabilities are encouraged to participate in the rehabilitation process. They are encouraged to initiate their own projects and programs and to take ownership of and sustain the rehabilitation projects and programs already established. This in turn aims to empower people with disabilities to live their lives optionally and independently within the community and their immediate homes. Rehabilitation program. This varies in different centers. Some centers may set up this with the aim of developing an intersectional, multi-professional, and integrated rehabilitation program within a community, service providers, government, and the academic field. Through such collaboration, the aim is to provide effective community and clinic-based services. Others may be in form of studying the individual, social, and cultural processes through which diseases, illness, health, and disablement will be defined, explained, and managed by the center. Using Halle Scott's clinic in the Kwandi Dangle area of South Africa and health service community of neuropsychology as a case study, we shall state the objectives of the rehabilitation centers as an intervention program. Objectives of rehabilitation as an intervention program. To examine and explain the patterns and distribution of diseases, biomedical taxonomies, sicknesses, social and cultural classifications and illness, personal beliefs and understanding. Rehabilitation investigates how the relationship between diseases, sickness, and illness affect the achievement of desired health status. In particular, it also studies the role of both formal and informal health care in this process, as well as the social, cultural, and psychological factors which may concern them. Intervention program may also engage in researching, establishing, and developing appropriate quantitative and qualitative methods through which information on disease, illness, sickness, health, and disablement can be gathered, stored, and analyzed. To initiate intersectional collaboration in the implementation of the rehabilitation program. This collaboration will involve the leadership of community leaders, service providers, and government sectors such as transport, labor, education, housing, agriculture, welfare, and public workers, and etc., and academic representatives. With this, the disabled will know that there is ability in every disability, because the functions of the different sectors will bring out the zeal from the disabled and thus make them feel that they are useful in the community. This is done because there are two major problems which disabled face in society. These are the attitude type and the access type. The attitude aspect involves the general perception of the disabled in the society and that of the government, individual, etc. This in form of discrimination, abandonment. They are only being patronized by coming into their aid, e.g. giving them arms, which is very wrong. The access aspect talks about the denial of their basic rights. For example, education, training, etc. Even physical access, e.g. transportation, public services are denied of them. Therefore, with the intersectional collaboration, the disabled won't feel these basic problems. To educate and empower caregivers of children with disabilities. In achieving this, the center has to handle and stimulate their children appropriately and effectively, encouraging community disability awareness, and to initiate income-generating projects and the development of the community. This will enable children from the fundamental stage in their life to put the negative perception of disability and the disabled out of their mind early enough. To encourage adults with disabilities to initiate the development of their own support group and income-generating projects within the community. This objective may be achieved by allowing adults to go into production, for example, shoemaking, which can be done by the physically disabled adults. With this income, can be generated from the project done by the disabled adults. To develop a database of people with disabilities in the society through the collection of data at each health post and clinic in the area. This is possible because of the staff of rehabilitation centers collaborate with colleagues in other disciplines, particularly health service organizations. Colleagues being collaborated with medical disciplines such as neurology, obstetrics, and gynecology, radiology. To establish the rehabilitation center as a base for a complete rehabilitation team. In so doing, the aim is to provide individual as well as group assessments, interventions, follow-ups, and referrals for daily clients, train and educate caregivers and community members in skills relating to disability intervention, community development, and rehabilitation program development. There is also some training for the provision of capacity building opportunities for students from varied institutions and backgrounds. This helps to develop the center as a resource for further research projects and intervention, and finally provide assistive devices and surgical appliances. A particular focus of rehabilitation centers' work has been to examine the ways in which individuals and groups of people in local settings understand and explain the ideas of health, diseases, sickness, illness, and disablement, as well as how they behave and practice in relation to those ideas. By setting such research in the context of broader and often quantitative analysis of more general data, profound and usually insightful findings of major policy relevance often result. With the availability of this, the disabled are led to know that language deformity is not enormity, and also allow the able to understand that equality can only be through participation. Neuropsychological rehabilitation and stimulation. This objective is based on patients who have brain behaviors. The Rehabilitation Center provides therapeutic intervention which is needed by the patient to optimize recovery of impaired cognitive functions, attention, memory, etc., and to facilitate the development of compensatory strategies. It also provides treatment for emotional, behavioral disorder associated with the actual lesion in order to facilitate the patient's adaptation process, and also maintains the patient's autonomy for as long as possible. Summary. In this lecture, the major objectives of rehabilitation were the focus, the processes needed to encourage the disabled to participate in rehabilitation were highlighted and discussed. End of study session 12. Thank you for listening.